She was desperate. She was depressed. And that's the horror of medical gaslight. The authority that we impose on people, we can break or make someone. We have to be very careful with that. While doing some research on different topics for this channel, I came across with an article about medical gaslighting. And it got me thinking, maybe I've been part of this at some point on my career. At the end of a shift, at 2, 3 a.m. in the morning, when I don't want to see no one, but have to. If I have a bad day, I really don't know. Or do I? Welcome back to my channel. This is Dr. Duncan, Dr. D. And today we're going to talk about medical gaslighting. Gaslighting. There was a 1938 play that later became a movie called Gaslight, on which a husband manipulates his wife into questioning her own perception of reality, her own mental sanity, and from there, the term gaslight, which means when a person is trying to manipulate another one into questioning their reality. The term medical gaslighting is when a health professional dismisses your symptoms. This doesn't mean that the doctor is dismissing your symptoms on purpose. But again, the fact that there's no ill intention doesn't justify the dismissal of your symptoms. Studies have shown that there's a noticeably disproportion of people when it comes to who is getting gaslighting. The people most affected by gaslighting include women, people of color, elderly people, LGBTQ people, and people with stigmatized conditions such as overweight or with mental illnesses. And it only gets worse if a person shares more than one category. Say, for example, a black woman or an non-heterosexual obese person. I want to share my experience. This happened to me a couple years ago. This is pre-pandemic, when I didn't know the terminology, gaslighting. A woman came to my office. She was a foreigner, around her 50s, early 50s. She came in and her face, her mannerism, you could see that she was disturbed. She was anxious. And she came in barging into my office and she said, "Doctor, first of all, I just have one question for you. And depending on this one question is how this interaction is going to go." So I was like, what? Like, okay. And before I could assimilate what she was saying, she said, "Do you believe in," I thought she was going to say in Jesus Christ, your Savior and Lord, but no. She said, "Do you believe in candidiasis?" And that was like, if I believe, she said, "Do you, doctor, believe in candidiasis?" I mean, like this sickness, like, yes. If you're talking about the illness, yes, it's an illness called candidiasis. Her expression, her face, that was the first sign. She was like, yes, like, "Thank you, doctor." Like, thanking me for believing in something that exists. And she just sat down and she said, "You're my fourth doctor. I've come to 2 previous general practitioners and 1 specialist. And I've had an awful experience. One of them told me I was crazy, like that. I was crazy. 2 of them told me, "Please don't come back. I don't want to see you again in my office." Yes. And all 3 told me that I was wrong and didn't even bother to do any test. any test of any kind. At this point, it was clear that because of her attitude, I was like, no wonder, I thought. Until I listened to her. She said that for months, she had been feeling this on her body, which was not right. And even though her symptoms wasn't related to typical candidiasis, she started researching because she knew what she was feeling. And she came to that conclusion. And for someone to just disregard her like that, she was getting desperate with each experience that passed. So when I told her, like, sure, first of all, I listened to her, and I checked her, and I told her, like, okay, yes, no problem. We'll do the test. It's not the typical symptoms, but we'll do the test. Oh my goodness. Her expression was unrepeatable. She was almost in tears. It didn't matter what the result was at that point. She was in awe. You know, this is the thing. I've always believed that there is no doctor that knows more about a particular patient's body than that particular patient. Unless it's a pediatrician. But that's an exception. You have lived with your body for so many years, and your body talks to you. We have learned with books and studies to see patterns, to see shapes, to see things that you normally doesn't see, that you normally don't pay attention. But you have lived with your body for years, and your body talks to you. So when your body talks, you normally listen. We are fortunate if we can take that experience and the information that you are giving us and apply it. But we as doctors are proud creatures. And sometimes that pride can be detrimental to our patients. Because no doctor want to hear from another doctor what we should do. More so from a patient. What do they know? And if it comes out like a crazy foreigner woman, come on. I'm the professional here. And from that point, we started to shut it down. Like we're not listening. You should be crazy. Definitely, you're crazy. And with the symptoms, this is not it. But if we should only take the time to listen. Needless to say, when the test came back, she had candidiasis. Tears poured through her face, and she was just thanking me. Come to think about it, no one have never thanked me for giving her the news or giving them the news that, yes, you have a disease. Thank you, doctor, thank you. It wasn't about the disease. It wasn't about the result. She as a person, again, I respected her. I respected her enough to consider her opinion. And what do you know? It came out positive. Now it didn't matter what other 3 professionals of health had made her feel. Her value, her respect, her place in society, her mind was at peace again. She came in very depressed, very anxious. And at the end of that second visit, she was a different person, a different attitude. And her face, her body language, she was a different person. In this case, you're taking a woman who has been for months having health issues, for months, having problems communicating. And when she does something so personal, 3 health professionals make her feel less because they didn't understand her position. I mean, it wasn't the issue that they disagree with her diagnosis. The issue was that in doing so, you are making her feel less and less of a person. She was desperate. She was depressed. And that's the horror of medical gaslight. The authority that we impose on people, we can break or make someone. We have to be very careful with that. Gaslighting, for a person to question their own sanity by someone qualified, it's not the same as if a friend or someone from the street tell you like you're crazy. But when someone that's supposed to know tell you, yes, you're crazy, you're worthless, you're not worth my time, not even your suggestion, go away, I don't want to see you again. That destroys. That destroys. But as a doctor, how do they got to that point of just disregarding this patient? And how do I avoid to get to this point? Or if I have done it at some degree, how do I make sure it never happens again? Why gaslight? For once, we're human. We are human. We get tired. We have our personal issues. And we have been taught in medical school that when we hear hoofbeats, think about horses, not zebras. Although it could be a zebra, but the possibilities of being a zebra are way lesser than if it was a horse. What does this mean? That we've been taught to think of the most common situation on a particular issue. If you're sneezing, if you're coughing, it could be a cold because it's cold season, right? I'm not going to be thinking about cancer, nasal cancer, lung cancer. I'll be thinking of flu season. So that's if you're coughing, if you're sneezing, yeah, that's what it's going to be. But our opinion as doctors, which has been unquestioned for centuries, all of a sudden, here comes Dr. Google. And Dr. Google, when you search coughing, lung cancer, okay, or tuberculosis, okay, yes, those are big zebras. And everyone started Googling and they're nervous, so they come with an opinion and doctors are like, what? Like, no, I'm the authority. I'm tired. I'm sick and tired of this Dr. Google. Everybody knows what? You're a doctor? So now you're going to Google how to fly a plane? Are you going to go fly a plane? Why do you think you have an opinion on medical issues? When did this change? So from there we are apprehensive. Also, in this age of high-pressure healthcare environment in which we have a limited amount of time to attend all our patients, as they are walking in, we're analyzing. We're saying, what does he has? He is limping. She's have that. Sneezing. I heard him coughing. Maybe it's a flu. So when they're walking in, we're making a diagnosis and thinking of any prescription that we should prescribe at the moment. So we are not listening as we should when the patient is talking to us, and we already have our conclusion, and we already have the medication for this patient, and we're ready, walking him through the door so we can receive the next patient. And in a world where we have to attend as many patients and we have to devote our 100% of attention to this patient in this particular period of time when he's sitting in front of me. He is my world. He has to see that I'm completely concentrating, even though I have problems at home, even though I have health issues of my own. I have financial issues, I have work issues, but I cannot show it. I have to concentrate on this patient. Sometimes when we are tired, we can slip and things happen. Gaslighting happens. But how to identify when you're being gaslighted? When we as doctors dismiss our patient's symptoms, or we refuse to discuss the symptoms, we just ignore them or make fun of them in a sarcastic way. Another one is if we are not listening to our patients. Like I mentioned, we are already typing in, we're already prescribing. When you're talking, we are not an engaged listener. That is a sign of gaslighting. If we're not paying attention, we cannot identify the key points to make a precise diagnosis. So that you should be aware of those signs. Another one, if we do not order key lab work or imaging studies that could rule out the patient's claims or symptoms, that could be a sign of gaslighting. Although I have to be clear, there are some times when what the patient is suggesting, it just is not what is needed. It just doesn't make sense. But we have to explain to the patient why it doesn't make sense. Why in this particular situation, the exam is not necessary. And give alternatives or explain why we think a different course of action should be better. Another one, when we are laughing or just suggesting that it's all in the patient's mind. It's all in your mind. Again, it could be true that it's a situation of anxiety, a depression, or psychosomatic symptoms. But in order to get to that condition, we should first rule out any physical condition. Like, yes, you're having headaches. You're having headaches because you're stressed. But if you're having constant headaches, let's do some lab work. Let's see how's your sugar levels, your hemoglobin. Let's see how is your cholesterol. Maybe that's causing it. Your blood pressure is fine, but let's check on this other things. So the patient, even though we don't agree with the patient should feel validated, should feel that his opinion or her opinion was taken into consideration and that we are working on a solution. So now, how can you help yourself to avoid gaslighting? One of the most effective ways is bringing a companion, a trusted companion to the medical visit and sit with the doctor. Someone who was there when you experienced the pain, someone who can remember key information when you're distracted or you're too anxious with your symptoms. Another thing you can do is have a journal. Write down all the symptoms, what triggers it, what make it calm. If you have lab work, bring it. That makes you look more organized. And to dismiss you as a crazy or anxious person is difficult when you are an organized person and have the records straight. Keep detailed notes and records. That would definitely help you. Focus on the most pressing issues. When you're focused on the most pressing issues, it's easier to, when the doctor is trying to dismiss you, to go back to the point like, yes, doctor, but going back to the main point. What can we do on this regard? Or what do you think about this? What is the next step that we should do to rule out this situation? When you're focused, that validates you as a person that's coherent and knows what you're talking about. And like I said, even if you're wrong, doctor is going to discuss and you guys will reach to an agreement on the treatment on how to proceed. And if all of this failed and you still doesn't feel respected, you still doesn't feel validated as a person, it's okay. Find a second opinion. Find a doctor that will respect you. Again, not a doctor that will concur with everything that you say, but one that will respect you enough to talk to you, to discuss your symptoms and treatment, even if it's not what you want to hear. At the end of the day, it's not to agree with the patient 100%. It's to make them feel respected. It's to listen to them. Pay attention to them. Consider what they're saying. Discuss the pros and cons of their theory. Sit down. At the end of the day, if it is, great. You made our job much easier if you have an idea of what's going on. If not, okay, this is why I think you are wrong. But we're going to do this and this to rule out and have a course of action, have a plan. We need to avoid gaslighting. As doctors, as healthcare professionals, we don't need to give that to our patients. And if we can identify that we are doing that, we have to stop immediately. We have to put our pride aside, and as difficult as it seems, our personal issues. And because we're human, if we slip, we have our patients, we have our community that will help us be better professionals, evolve as professionals, as patients. So thank you for sticking around. Next topic, if you have any suggestion, just write it down in the comments. Please share, subscribe. Let's grow this community and let's share knowledge. Let's share our power. Knowledge is power. Let's be powerful. Until next time, you can check the other videos and have a great one.